This must end. It is now time to open Texas 100%. Everybody who wants to work should have that opportunity. Every business that wants to be open should be open.
Now, the Johnson & Johnson vaccine rollout is set to begin today with nearly 4 million doses shipping across the country. Now, these 4 million doses are only the very first batch of the expected 20 million doses that Johnson & Johnson promised to deliver by the end of the month. The Johnson & Johnson vaccine is the first single-shot vaccine to be approved by the FDA. 100 million doses are expected to be manufactured by the end of June. This next, the CDC says that approximately 10% of the adult population of the U.S. is now fully vaccinated against the coronavirus. In all, over 96 million doses have been delivered across the country, with nearly 77 million given. Now, this means that nearly 20%, over 50 million people, have received one or more vaccine doses as the vaccine rollout improves with the addition of a third vaccine. Now, these numbers are sure to grow moving forward. And finally, the University of Alabama says it is planning to return to full capacity football this fall in the 10th largest stadium in the world. The Bryant-Denny Stadium has a capacity of 100,000 spectators, a figure that was reduced to only 20,000 last season due to coronavirus. Now, the university is also planning to return to traditional in-person instruction without any classroom capacity restrictions this upcoming fall. Yeah. Bob, Heather, that is fantastic news coming out of the SEC.
You know, they're like 47% of people have either had coronavirus or been vaccinated. So between now and summer, they're hoping that gets up to herd immunity standards. Yeah. So that's going to be for everybody, let's hope.
Yeah. That'd be fantastic.
But let's talk football, too.
Yes.
Football.
Normal football.
All right. Thank you.
Thank you.
Well, we have some breaking news on coronavirus, specifically from Texas. Texas Governor Greg Abbott announcing today that all businesses of any type will be allowed to open at 100%, and the mask mandate will be lifted next Wednesday. He's also saying this about schools.
This must end. It is now time to open Texas 100%. Everybody who wants to work should have that opportunity. Every business that wants to be open should be open.
Well, Governor Abbott went on to say that the virus is not going away, but he insisted that the state is far better equipped to fight COVID-19 than it was last year, thanks to vaccines. And joining us now to discuss is emergency room physician, Dr. Richard McCormick. Thank you for joining us. And what are your thoughts on that breaking news coming out of Texas?
I think it's great. I think it's overdue. I think all along we as Americans should have that opportunity to make the choices based on an educated process where medical professionals deal with their patients, we educate the public, and then they make their own hard decisions. Before I was a Marine, before I was a doctor, I was a Marine, and one of the things I cherish very dearly is our rights to self-determine.
Mm-hmm. Yeah, and among the things you dealt with when you were a Marine, as I recall from previous conversations, are logistics. And I wanted to see, are you seeing improvements in logistics to get some of these vaccines out there?
Absolutely. We've learned a lot of hard lessons. We've gotten it out to one of the things I love about the Johnson & Johnson's vaccination is that it doesn't have to be refrigerated the same way, which means we'll be able to push that out to CVS and other places where you can actually have pharmaceutical places distribute them. You don't have to have the same bottleneck of the efficiencies that we've had problems with is always finding the facilities and the personnel that can administer these shots. Now that'll be much easier to do.
Yeah, Dr. McCormick, that's one of the issues that I've asked about. You know, where is the holdup? Is it in terms of distribution, or is it in terms of manufacturing the vaccines? I mean, do we have enough vaccines to go around, but yet we can't get them in the arms of people that need them?
So it depends on which state and which community you're talking about. At first, it was a distribution problem. We didn't have the people. Remember, most people that would distribute these things were medical professionals who were actually treating patients. Mm-hmm. And we didn't have those because you had to have special storage facilities. You had to have people who actually were trained to administrate it, people to actually do the administration portion, which is to document who gets it so you could know when they're supposed to get their second dose. Now you're going to have more and more people that can do that, as well as the sheer supply to all the different people who need it. Remember that the Johnson & Johnson will not have the same efficacy. It's more around 70% instead of 95%. Maybe this is the kind of people, these are the kind of people that need to be vaccinated at the lower level, the healthy people that we just don't want to spread the disease, but are not so much in jeopardy of dying from the disease.
Yeah, let's talk about that, whether you can spread it once you've had your vaccination.
Not only can you spread it, but you can also get it again, not to freak you out or to get you scared. But remember, if you survive it the first time, your chances of surviving the second time are quite good. As a matter of fact, better, because you do build some immunity. And you did survive the first round. That means you have the propensity to survive that sort of disease process. Not guaranteed, but remember, we're going to be dealing with this for the rest of our lives. I know that's disappointing to hear, but we have variants every single year in the flu that we try to vaccinate against. On a bad year, we lose up to 70,000 people from flu, and that's been around for 100 years. So we have to remember we're going to be dealing with this forever, but we'll get better and better at treating it and also being vaccinated against it.
Yeah, a good friend of mine and former colleague, young mother of two, died of the flu a couple years ago when we had that really bad spate that went through. So how do we get out of this then? I mean, with what you're saying, you know, this is going to be around. How do we get beyond wearing 2 masks or 3 masks, whatever the next rule is? How do we move on and get back to normal life?
So this is what I've been preaching all along. If you look and compare the states that have been open and the countries that have been open compared to the states who have been closing down, you'll find that there's not a lot of dissimilarity in the mortality rates. In other words, who has the highest mortality rate of anybody? It's those states that have cracked down, such as New York, New Jersey, that have extremely high rates. Now, that's not just due to one factor, but let's face it, closing schools and closing restaurants has not made the impact that people thought it would. You can make all kinds of cases for masks and distancing, but that's all based on an individual effort and being sure that you wash your hands, make sure that you're not around sick people, make sure you isolate the people who are most vulnerable. We can do that while still opening up, let people make their choices, let people get back to work, let people control their own destiny. That's what America's always been about. And it gets very scary to me, not just as a physician, but especially just as a citizen of this great country, that will allow the government to take away our God-given rights. Remember, we're the people that should be giving the government power, not vice versa. This is an individual choice we make when we go rock climbing or speed or travel abroad to climb mountains. We make choices every day that are risky, whether we choose to get the vaccination or not, whether we're out in public or not. Those are choices that we as Americans have always been able to self-determine. And I think it's very dangerous when the government starts to overreach.
All right. Dr. Richard McCormick, thank you so much for joining us.
Right. Also, right now, speaking of COVID, President Biden speaking at the White House about the vaccine rollout. Let's listen in.
Pharmacies to make it easier for folks to get their COVID-19 vaccine shot like they would their flu shot. The federal government is also working with states to set up hundreds of mass vaccination centers in places like stadiums, community centers, parking lots that vaccinate thousands of people per day. My wife Jill and I just visited one in Houston last week. It's incredible. And with this increased production of 3 safe and effective vaccines, we have an opportunity to help address the urgent national need more quickly and getting our schools back open safely. Right now, an entire generation of young people is on the brink of being set back a year or more in their learning. You can ask millions of parents, they understand. We're already seeing rising mental health concerns due in part to isolation. Educational disparities that have always existed grow wider each day that our schools remain closed and remote learning isn't the same for every student, as you all know. Our educators are doing everything they can to protect and educate our students despite the lack of resources and as districts face budget crises that risk education jobs. Moms and dads are exiting the workforce in astonishing numbers in order to care for and manage the school experience for their children at home, hindering their own opportunities and further undermining the health of our economy. This is a national imperative that we get our kids back into the classroom safely and as soon as possible. As you know, back in December, I set a goal for having a majority of our K-8 schools open by the end of my first 100 days as president. To achieve that goal, I sent the American Rescue Plan to Congress to provide vital help to make sure schools can reopen safely. Essential things like more teachers to reduce class sizes, more buses and bus drivers.
All right, President Biden, talking about the vaccine rollout, I mean, there are steps being taken, including Merck has agreed to help make Johnson & Johnson's new vaccine, and a lot of people think that's a positive step.
Right, yeah. Hopefully we'll get it to more places, which then can get it into more people's arms.
Yeah. That's the goal, because that's the way it gets on the other side of this, of course. Let's, I don't know what topic you want to talk about to our panel, because in this show, often we go off the, by the seat of our pants, if you will. But I'm kind of struck, Tony, I don't know how you are, the Cuomo thing really strikes me. I mean, their golden boy, their golden child, suddenly is not so golden anymore. We're talking about Cuomo even being kind of stripped of powers by the largely Democratic Assembly in New York.
Well, if they can't do anything else to get rid of him, they can at least try and make his life difficult.
Yeah, because there's no recall.
Right? It's not the only place where those conversations are happening. In my beloved Indiana, you have a Republican governor, Eric Holcomb, and the idea that these emergency mandates can't just go on ad infinitum without input from the people. So it's a worthwhile conversation. But I'm sorry, I got to get back to that whole Joe Biden thing. We need to get the kids back in school. When did Joe Biden decide to take on the American Federation of Teachers, which has been blaming Republicans for being the problem and wanting teachers to die and students to get harmed? And now he's going the other way. I can't wait for that phone call from the American Federation of Teachers and Joe Biden. I would love to be a fly on the wall for that one.
Yeah, Heather, you've been following that.
Oh, yeah. I mean, we were just saying off camera that now Mississippi is now lifting its mask mandate across the statewide mandate that's been in effect since the beginning of August.
Good.
But the governor will still require them to wear the mask in school, but he's getting them back to school.
At least
which
they're going to school.
Absolutely, you know.
Kristen, I want the kids in school. I don't understand how after a year this is still a question.
It's so destructive keeping kids locked in their houses for almost a year now with this inferior virtual learning that's really failing our underserved communities.
Yeah.
It's just such a joke, especially because we've known now for many months, based on data and studies, that in-person learning really does not lead to significant spreads of COVID among staff, students, or teachers.
Yeah,
so,
Boris,
time.
Yeah, I'm with you. Boris, we got like half a minute. You've been following this all along. You hit on a topic I'll talk about all day, and people will get bored with me on it, but Tony, but Boris, I think you'd agree the schools need to be open. We can't hear Tony. I know he's saying
Boris.
good stuff.
Yeah, we can't hear Boris.
I'm sorry, we
I'm
can't
saying
hear
good
Boris.
stuff. I'm saying good stuff. I was
There he
saying
is.
I've got a little boy. He's almost 5. I want him back at school. We all want our kids back at school safely. And one thing to note there, Joe Biden, let's just be honest, does that guy look like he's up to being president? I mean, that is so troubling just to watch those few seconds that we got to see of a person who's obviously not in control of that office. To Tony's point, he's all over the place on teachers, all over the place on schools, saying things that absolutely do not line up with what Biden actually ran on. And, you know, this is a statement from Joe Biden. What about a press conference? I was in the Trump White House in the early days. President Trump went out and he did press conferences.
Yeah.
He answered questions. What about a press conference from Joe Biden? Or does he need Joe Biden to be there next to him to answer the questions for him all the time?
Yeah.
Fair enough, Boris.
Yeah, they were asked about that again today, and they would not commit to one. Thank you, everyone.
Circle back.
Yep, circle back, exactly. And we'll circle back with everyone right after this, so don't go far.
Hi, Emma Reckenberg here. If you like this video, there's a whole lot more to see on Newsmax TV. You can watch for free right here on our YouTube live stream and be the first one here each time our experts break down real news. Just hit that subscribe button, ring the bell icon, and stay with us on America's fastest growing cable news channel, Newsmax TV.